Salina Regional Health Center has a pre-doctoral psychology internship with Veridian Behavioral Health. My name is Cameron Skonhovd. I'm one of the interns there.
Well, Cameron, thanks for being on the show. I think a lot of our viewers maybe know about some of the schooling for physicians here in town, KU School of Medicine, the Smoky Hill Residency Program. But Veridian has a pre-doctoral candidate program that you're a part of, the internship. Why don't you tell us about the program?
For sure, yeah. I think it is a bit of an unsung organization here in town that really provides a lot of really important services. You know, doctors, physicians have residency programs, which is kind of their final end to their program, the last bow on their training. And in clinical psychology, for a doctorate in clinical psychology, we have the internship program. Okay. And so they have one in town that I was actually really excited to be able to be a part of. They actually have there they focus on providing this really crucial last step in doctoral training to prepare people to be clinical psychologists and provide a lot of generalist training to help people and specifically working with the rural population.
Well, let's go into a little bit of details about the program, kind of take us through the stages of the doctoral program.
So there are a couple of different elements of the program. Like I said, we're generalists, which means that we try to offer a variety of opportunities and training opportunities for students, which I'm very excited to get to do. One of them is doing outpatient, long-term outpatient psychotherapy, working, like seeing a client once a week, like we think of classically when you think of therapy. Another aspect of that is doing group therapy in outpatient, which is where we'll be setting up a group to do psychotherapy for a 9-month stint, and then also learning to do inpatient therapy as well. So a lot of stabilization for more severe diagnoses in the inpatient unit. One-on-ones, but then also doing group therapy for the inpatient, which I've actually found to be a really rewarding experience. I have a deep passion for people that experience schizophrenia, and I get to work with people there, and you really get to spend time getting to meet with people that many people I think don't understand, or they gloss over really easily because they're so hard to understand. So that's been a beautiful part of the training. There are 2 campuses. There's one working at the East Campus where we'll be seeing people in outpatient, a little less severe, but we'll be working primarily kind of alone as a therapist working with patients. The real interdisciplinary work kind of comes in when you work in the hospital, where I'll be working with psychiatrists, working with nurses, and really, and even what is it called? Activity therapists that teach people, like help people get active, and that's a huge central part of fighting depression specifically. So when working in the hospital, you get to work with a variety of different people, variety of different perspectives that really helps, really balance out your blind spots when you get to, because I know what psychology may say about this, but working from a nursing perspective or a strictly medical perspective, you really get to broaden your understanding of a person.
For more information, go to veridianbh.com and visit the Psychology Internship page located under the Services tab.